Well, thank you everybody for attending our webinar. I'd like to get started now. My name is Michael King and I'm joined with Dr. Luke from our clinic here. Dr. Luke, how are you doing today?
I'm doing great. How are you, Michael?
I'm fantastic. So, when we do these webinars, we really want to make this all about you and your journey. And if you are wearing glasses or contacts, you've probably been thinking about laser vision correction for a little while. And what we really want to do, and we want to be of service for you here today, and just to answer any and all questions that you have about LASIK or vision correction. Any question is fair game. Dr. Luke and I really enjoy doing these, and to kind of just to get started right away. Well, first off, as a way of thanking you for attending, everyone that's attending the webinar will save $1,000 off their procedure at ClearSight. And really, the first thing we want to kind of start into is identifying why you're considering laser vision correction. And if you've been thinking about LASIK for a little while, there's typically one of four reasons that we have found that a patient is interested in doing it. Number one is the obvious, which is freedom from wearing glasses and contact lenses. And so perhaps if you are you're a stay-at-home mom and you want to be able to hold your child without fiddling around with glasses, or maybe if you want to improve your golf shot, or maybe we do everyone from pilots to just people who just frankly are tired of fiddling with glasses and just lenses, if you will. Those are your reasons. And so the reality is that freedom from having to wear glasses and contacts is a very liberating experience for patients. And so the second one would just be purely lifestyle. If you exercise a lot and you find that you get sweaty, it kind of smudges your glasses, or it's rarely is it an event that happens just once and now you make the decision. It's typically over the course of a few years that people make that decision, and then especially after they've talked to a friend or family member who's had the procedure done and they realize just how quick and easy it is. So one that I like to talk about is the time savings. And if you look over the course of your lifetime, you really are spending a lot of your life, unfortunately, having to fiddle around with those contact lenses, or having to go reorder them, or get a new pair of glasses, or et cetera, et cetera. And so you do save quite a bit of time by not having to wear them. And then the last one is the obvious, which is the cost savings. And so over the course of your lifetime, and we'll go into this a little bit later, you can just save literally tens of thousands of dollars by not having to spend money on glasses and contacts. Dr. Luke, when we're chatting with patients and you ask them kind of what got them to this point, is there any either a story that's kind of stood out to you from patients, or any reason that you find why our patients are considering laser vision correction?
There's so many reasons, and I think all four of these are great examples of reasons people have wanted to have glasses, or wanted to get rid of their glasses. And there's one story that always sticks out in my mind, and there's a young gentleman. He was 22 years old, and he and his wife both wanted to get laser vision correction at the same time. And I should say future wife. A week later, he sent me a video of him proposing to his wife, and he said that he had never been able to see very well in his life, and he said she was more beautiful than he ever could have imagined. And
oh wow, that's awesome.
Yes, and there are plenty of reasons, but that was one of those that really pulled on my heartstrings, and it's just such a great procedure for so many people.
Yeah, absolutely. And here's some kind words from some patients of ours, and one thing I do highly encourage you as you're going down this journey to decide if this is right for you in your life is to read the experience of other people. And we really pride ourselves on the care that we provide here at ClearSight, and just we treat all of our patients like family. And so it's something that we love the work that we get to do, and we love that our patients kind of tell it. We love to hear your story too. So if you want, go to Yelp or go Facebook especially, and or Google, and you can kind of just read some of the stories and the journey that other people have gone on before you. And so, when it comes down to it, again, I want to ask yourself, why are you considering laser vision correction? And hopefully we've been able to provide you with some of the reasons that other patients have considered it. But again, it's the stuff that I've mentioned already. So if when it does rain, it can get a little foggy and a little wet, a little smudgy. Alternatively, when summertime, which is coming up, if you don't have a pair of prescription sunglasses, then you're going to find yourself with the somewhat annoyance of not having that clear vision that you would like. And so buying prescription sunglasses can be expensive. On the other side, what would happen if you unfortunately sleep with them on? And so I remember growing up, there was friends of mine that were having a sleepover, just friends at a friend's house, and one of the guys was like, just really frustrated because he forgot his contact lens solution and his eyes got extremely dry. And so I never really understood it until I've been in this industry, and so that's a very real issue that people have. Is just it can be inconvenient if you haven't planned for that. That's kind of an obvious one. Again, don't want to fall asleep with them on with your glasses. But contact lenses, I think with contacts, what patients find is it's really just that hassle of fiddling around with putting something into your eye. And as we'll talk a little bit later, contact lenses do make your eyes a little bit drier. And there's actually some studies we'll show later that talk about that LASIK can be safer than long-term than wearing contact lenses, and we'll talk about that in a moment. As I mentioned, contact lenses can make your eyes dry. You can get an eyelash in your contact. There's a lot of different reasons why patients are considering the alternative, which is laser vision correction. And so this is the area of the webinar where I really would like to encourage you to kind of think to yourself, what is it that's held you back from having this done? If there's some question or fear or anxiety or worry or anything like that, everything is fair game, and Dr. Luke and I would be honored to answer any question. I assure you, we've heard almost every question that could possibly be answered, and so we'd love to be of service and be able to answer those for you. And to sort of prime the pump, if you will, excuse me, on questions, we put together our top 5 questions about laser vision correction, and this is where I'm going to lean on Dr. Luke to be able to answer some of them. And so the first question, Dr. Luke, if you will, comes down to recovery time. So if I'm a patient and I've just had laser vision correction done, could you kind of carry me through what happens from that day and what a patient should expect, recovery time and discomfort, if you will, and then conversely, how much time do they need to take off of work? So what are your thoughts about that?
No, that is a great question, Michael. Thank you. LASIK has evolved from what it used to be 10, 20, even or 20 plus years ago, and the recovery time for LASIK is much less than it used to be. The procedure itself takes about 10 to 15 minutes. Typically within 24 hours, most of the vision has returned, although there still can be some halo and glare as you're healing. But typically you want to take off the day of your procedure, typically much of the next day. But after that, you can go back to most of your normal activities. So really just a day and a half is all you need to have LASIK.
Great. And what about number 2? So is this a permanent procedure? Does a patient need to have it redone, or if they do need to have it redone, how often does that happen? What's your thoughts about that?
That's another great question. So as I mentioned before, LASIK has evolved from what it used to be. We're now able to treat the entire cornea or a much greater part of the eye, and LASIK is permanent. The changes we make to the cornea are stable. But the rest of the eye can age, and people do need reading glasses as they get into their 40s, 50s, and beyond. But the vision correction that we do with modern LASIK is permanent, yes.
Absolutely. Now, question number 3 is one that I know you're very excited about because of all the different types of technology and services that we offer at ClearSight. So, curious, Ruth, for I'm a patient who is over the age of 40, and what are my options for reading vision, and what are my options? Am I stuck kind of where I'm at and never to be able to have good reading vision again, or are there options in technology that can be able to help me out with that issue with my up-close vision?
Yeah. So question number 3 is one of the many reasons that I'm excited to be a refractive surgeon. There's been a literal explosion of different types of technology for people over the age of 40. Traditionally, LASIK had allowed for good distance vision or through monovision, both distance and near. But now there are corneal inlays, there are lens replacements, and other very new technologies have been shown to have excellent results in people over 40. Now, before we invest in and use any of these technologies, we do go through a process where we make sure that it's safe for our patients, and we only do procedures that we know will have the best results.
Absolutely. With respect to pricing, that's one I'm going to go through a little bit later on in the webinar. What about question number 5, Dr. Luke? Safety. So, how safe is this procedure, and kind of what are some of the steps that we take either operationally in the clinic or also technologically, whether it be eye trackers or the other things that the lasers have for safety? When a patient asks you that, how safe is this procedure? What are some of the things you would say to them?
Great question. So I love this statistic. So LASIK has been shown to be the most effective elective procedure in the world. There's nothing that comes close to it. With modern technology, we have pupil trackers that can track your eye up to 1,000 times a second. We have perfected ablation patterns, and what that means is that the pattern that the laser uses to treat your vision has evolved into an almost to a perfection, or essentially to perfection. And the risks are 1 in tens of thousands for anything bad happening. So, are there risks? Absolutely, but they're extremely small.
Excellent. Another question that's not on here that I wanted to kind of to ask you is, let's talk about night vision. And so in research, sometimes patients, specifically with older LASIK technology, in the past there was sometimes there was an issue with glare or halos or issue with night vision. How does today's technology handle those issues, and is having glare and halo post procedure something they need to be concerned about?
So that is a great question. So this was a study that was done even a few years ago, before even the most modern technology, and somewhere between 30 and 50% of people have a better quality of vision than they could have had with just glasses or contacts. With the newest technology using wavefronts and topography-guided treatments and all the newest things we've had over the last 3 to 5 years, almost everyone has better night vision than they had in the past. Now there are some exceptions, but with the vast majority of people, we can improve your night vision.
Absolutely. And again, ladies and gentlemen, if any of you have any questions in addition to that you'd like to have answered, we'd be happy to answer any and all questions. So with that being said, so Q&A can still continue. I'm going to continue on with the webinar, and then as the questions pop up, Dr. Luke, I'll be sure to answer them, ask them to you.
Perfect.
So the next one I wanted to do, we talked about LASIK from the patient aspect, from your journey, if you will, and now I wanted to, excuse me, provide you with a little bit of research, recent research that has been done, talking about the safety of LASIK over contact lenses. And the reality is, excuse me, as much as we would like to believe that patients, everyone washes their hands and gets them nice and clean and whatnot prior to taking in and out their contacts, a lot of times they don't. And so you actually have a higher risk of getting a bacterial infection from wearing contact lenses than you do with LASIK. And so with LASIK, the anti-inflammatory and the steroid drops that we use afterwards really combat any sort of potential issue from the healing process afterwards. But it's really just such a because it's what we'll call a surface ablation procedure. It's on the surface of it's not deep inside your eye. That's one of the reasons why LASIK really has an extraordinarily low risk of any infection after the procedure. I do have a question here, Dr. Luke. Actually, I can handle this one. Would improvement of night vision cost more? Mayari, thank you so much for that question. No, it would not. The technology that we have invested here at ClearSight is the latest technology that is able to, through the analytics on what we gather at the initial consultation, that enables us to get the proper analytics and information and put that into your procedure. So we really believe in using the technology that's going to get us the best outcomes, and that's standard practice at our clinic. And one thing I didn't mention at the front side, but I will mention now, is that our goal with this webinar really is not to convince you to have the procedure done. Our goal is really to do one thing, which is to help you feel comfortable with making one decision. And that decision is, would you like to find out if you're a candidate? And if the answer is yes, at the end of the webinar, we'll kind of talk to you about how you can be able to do that. But that's generally the first step for everybody, is medically speaking, are you able to have this procedure done? We find, sometimes 10 to 15% of patients may not be the right candidate for laser vision correction, and we go through that at our complimentary consultation. So I wanted to mention that one other point. So thank you, Mary. That was a great question. As I mentioned earlier, there are health risks of wearing contact lenses, which you can see on the screen. It's kind of a paradigm shift for people, because they've always thought that wearing contacts is generally could be safe, but over the years, the most common issue patients have is their eyes get really dry, and so you have an extraordinarily low chance of having any issues post LASIK. You actually have a higher chance of an infection from contacts, as I mentioned earlier. Here's where I'm going to go in and talk to you about the lifetime cost of glasses and contacts, and also about pricing. You can see the pricing on the screen there. As I mentioned, you get $1,000 off our premium technology here at ClearSight. So that $59.98 would go down to $1,000. And when you think about, what's what should someone expect when it comes to LASIK pricing? I really think you want to choose a practice that obviously is using the most up-to-date technology. You'll find that we're not trying to be the lowest priced provider of laser vision correction. We really are offering what we believe to be an outstanding service for our clients. And if you are interested in financing, we've got excellent options: 0 down, 0%. But the main thing on this screen I'd like to focus on would be, if you look over the cost of your lifetime, being able to get exceptional vision right now with having laser vision correction done is going to save you over your lifetime tens of thousands of dollars. It's amazing how much we actually spend on glasses and contacts over a lifetime. Dr. Luke, I do have a question here. So if I go in to a practice, and why would one practice, for example, tell me I'm a candidate for LASIK, and another practice maybe tell me I'm a candidate for having a corneal inlay, which would be for the reading vision? So what are your thoughts about that? And I think we could probably maybe talk about monovision a smidge, but what's your take on that question?
That's a great question. So the field of refractive surgery is very robust, and all that means is that we have a lot of options for people. LASIK does a wonderful thing. It brings the eye into focus. Now, if you're looking to treat, if you want to treat near vision as well, you can use monovision, you can use corneal inlays, and there are pros and cons to everything. And that's the benefit of having a very comprehensive exam. We want to make sure that we understand what you're a candidate for. We want to make sure that we do whatever's right for that, right for you.
So the great part about what we provide is that we have the variety of options for you, where some practices maybe only will be able to provide you with one option because of how committed we are to technology and offering our patients that variety of the latest procedures. That's one of the benefits of coming to ClearSight. That was a great question. And great answer, by the way. In 2014, the FDA released a study that essentially is showcasing that 95% of the respondents got 20/20 or better. The LASIK technology that's used today is incredibly safe, and the results are outstanding. Outstanding. This is one of the best times ever for someone to consider laser vision correction. And so the next slide here is one that you can kind of read on the screen. This is where we get to talk to you real quick about who we are. Really, it's the most important thing I would love for a patient to hear is how passionate and committed we are to your care. And you do have a choice about where you would like to go and to have your corrective procedure done. Our hope, obviously, is that you would come to us, but it's what you will get at ClearSight is that feeling like when you walk into our practice, we want you to feel like you're at home. We want you to feel like you are in a place that treats you like family. That's something that that we pride ourselves on and take great steps to be able to give you that feeling of comfort. We know that this procedure can be one that people have a little bit of nervousness or a little bit of anxiety about it, and we embrace that, and we want to be part there with you as your guide, if you will, on this journey. And so I think that if you would like to find out more about our procedure or our practice, I'd highly recommend that you again go to Yelp and Google and Facebook and kind of see what other people have said about us. And this is my favorite slide, Dr. Luke, because I get to talk and say nice things about you. And so, I think that in the time that I've gotten to, in the time that I've been working with Dr. Luke, he's one of the most genuine and caring people that I know. And I'll give you an example. The fact that he gives our patients his personal cell phone number for you to, you'll get a text or a call and kind of just checking in on you. And those are extra steps that we take that we don't have to, but that we choose to do because we really are committed to your care. And so, Dr. Luke, I think, for the people that are on the webinar right now, tell us a little bit about sort of your journey to get to this point. Why did you decide to do, to kind of, specialize in this specific industry? What was the sort of the driver for you on that? I'd love to hear your story.
Well, thank you for the wonderful compliment, Michael. My vision journey started when I was 6 years old. I was just finishing my first, or I was in the midst of my first grade, and I wasn't able to see the board, and I started wearing glasses when I was 6.5, and I never really knew what good vision was. But I had difficulty with glasses and contacts. I wanted to be an athlete, and I had a lot of difficulty with that through most of my life. Right before I started my internship after medical school, I had LASIK, and I had better vision within one day than I'd had my entire life that I could remember. And it was a almost a sentimental moment, and ever since then I have wanted to offer that same service, that same ability that I had to everyone else. And that's why I chose to do ophthalmology as well as specialize in vision correction. And I want to make sure, from the result that I've had, I want to make sure that I have every tool in my tool belt to make sure that I can have the best result for my patients.
Fantastic. Appreciate that. And so as I mentioned before, these are some kind words that patients of ours have said about us, and I encourage you to again take the time and kind of just check us out on Google and Yelp and Facebook, and kind of just engage in conversation. If you have any questions that you'd like to have answered, you're more than welcome just to kind of jot them to us on Facebook. We're on there all the time and answer them for you. And so, here's the opportunity for you, which is to find out if you're a candidate. And we like to keep these webinars to a little bit under half an hour, and respecting the time that you've got, and we appreciate you spending time with us here today. But if you'd like to find out if you're a candidate, that is the next step. It's absolutely complimentary. It gives you that chance to kind of meet our medical staff and come on in, and we can find out if, medically speaking, you are a candidate. And there's no obligation or pressure after that consult to see, to have the procedure done. But it really gives you and gives us all the information we need to know about moving to the next step. And so that's the next step for every one of you. That we'd like to encourage you to take us up on that if you'd like. I have a question here. I'll tackle this one from Miari. Great question, Miari. How long is the procedure? The procedure is roughly 10 to 12 minutes. It's quite quick. you know, when you come on in and you're about to have the procedure done, I'll kind of talk a little bit about what happens. And Dr. Luke, feel free to jump in at any point. So, you know, obviously the first thing we do is you know, a patient's eyes will be dilated, and if you're feeling a little bit nervous, we have a sedative for you. When it comes to the actual procedure itself, the first step is to do what we call creation of the LASIK flap. And so essentially imagine that you've got two windows, and we need to lift the first window, and we use the laser to be able to do that. That takes roughly 15 to 20 seconds per eye. Once we've actually created that LASIK flap, then we position you underneath the laser, the second laser, which that will do the reshaping of your cornea. There's an eye tracker that locks directly onto your eye to be able to make sure any involuntary movement is caught during the procedure. And really, it's the lasers reshaping your eye for merely seconds. It's incredibly quick. The lasers that we have right now do an exceptional job with that. And so then after we've done that second part of the procedure, we lay that flap back over, put on some medicine drops, and do your second eye, and then we're complete. And so, you know, after you do a last check-in with your eyes to make sure everything's settling in, you're pretty much free to go after that. You know, we kind of have you rest for a little bit, making sure you feel okay. But this is something that you want to go home and go to bed and have a nap. But the actual procedure itself is very, very short. Dr. Luke, did you want to add anything to that about the procedure?
Yeah. Everyone, I ask everyone who comes in for this procedure how they're doing, how they're feeling, are they excited? And everyone has the same, and almost everyone has the same response. They're both excited, and they're both and they're also anxious, which is completely normal. I felt the same way. You know, the procedure itself is extremely straightforward, and you know, Michael, thank you for that that assessment. And you know, we use very low pressure just to hold everything in place, and all you have to do is just relax and look straight ahead. We have the fastest eye trackers available, and it's almost impossible to have any problem, and we do everything we can to make it as safe as possible for you.
Excellent. And another question we had, which was, you know, if a patient, you know, we see all different varieties of patients, and there are patients, you may have heard of a friend or family member, well, I need to have it done a second time, and so I wanted to add on to that question we had earlier. So when I'm speaking with patients, here's the analogy that I give to them is imagine that 2020 is a diamond, and some people imagine there's a rock around that, and that rock is your prescription. We have some people that have a small rock or a small prescription, and other people that have a larger rock or a much larger prescription. We can see people from -1 to -6 and above. And so what happens is that, you know, the lasers are incredibly accurate, but you know, we're not we're dealing with human tissue, and so sometimes a patient may over or slightly under respond to the treatment, and that's okay. Everyone's different. We're all unique in life, and so what happens is that if there's a patient where after a certain period of time of healing, it's a very small percentage of patients, but if you are a patient that perhaps had slightly under responded to the treatment, and we can get you a better visual outcome with a secondary treatment, we want to be able to provide that for you. And so that's our 2020 guarantee, is that we are committed to getting you the best possible visual result. And so 2020, where it's free, is something that, you know, we were the first practice in Oklahoma to be able to offer that. And just to kind of let you know that we are that committed to getting you the best visual outcome. In closing, the vast majority of patients only need one correction, but because we're committed to getting you that visual result, if we need a second correction, we'll absolutely do that for you, and we're there for you every step of the way. Now, I guess just the final is I want to give just a kind of just wrapping it up and give a couple more minutes if there's any final questions. This is again a great opportunity to ask myself and Dr. Luke anything that you've wondered about LASIK that maybe you haven't ever had answered. Hopefully we've done our job and giving you a little bit more of an understanding if this procedure is right for you. So Dr. Luke, while I'm giving people that opportunity to ask any final questions, do you happen to have, or what would your closing words to somebody who's maybe on the fence or considering laser vision correction, what would you like to say to them?
Well, from my own standpoint, and my wife will stand by this. LASIK was the second most important thing I've ever done in my life. One of the second best things I've ever done. Marrying my wife was number one, of course.
Of course. Well said.
But no, LASIK is not the same LASIK that it was 20 years ago, and it's with modern technology, the results are really unparalleled. I'll say it one more time. There's no other elective procedure that has the success rate that LASIK does, and we're excited to be offering it.
Absolutely, and it's hopefully you've been able to hear it from Dr. Luke and myself. We are incredibly grateful that you've taken the time out of your busy days to spend some time with us and learn about this procedure. If you have any questions that kind of come to mind afterwards, feel free to reach out to us at the office or on Facebook, or you can, if you want us to pick up the phone and call you, whatever works for you. We're here for you every step of the way. So on that note, Dr. Luke, I don't see any other questions, so I want to give everyone again, much thanks for coming in today, and we appreciate you spending time with us. So thank you, everybody, and have a wonderful rest of your day.
Yeah, thank you, Michael. Thank you, everyone.